All right, thank you for that very nice introduction. It's been great to be here for this is my fourth week now, and learning about all the amazing work that's been going on across campus. And this is a community that I really look forward to learning about the great work that you're all doing. A lot of you may know part of the role that I'm coming in to play. It's to work with other leading experts in their fields, like Zahi and others, to lead tMII's new initiative in precision medicine, which I'm very excited about. It's, to me, one of the potentially the boldest initiatives that kind of takes big data from the outset and thinks about how we can harness the enormous amount of data that will be generated in the next several years, currently existing and will be generated to advance human health and make new discoveries. So we have harnessing or building on my predecessor Eric Schott's words. He used to talk about harnessing the digital universe. So we're starting to think about some of those terms, and we like to be big and bold. So we've been talking about where we could go with institutional initiative, and starting to think about words like harness the digital universe to end disease as we know it. This is all in flux and to be discussed, but that's the kind of boldness that we're looking for, and the kind of orientation to really take advantage of all of the big data that will be generated. So I like to think of that as, in the future, when a patient comes into Mount Sinai, we'll be able to characterize their disease in great molecular detail using imaging technologies on my side of the fence, genomic technologies, and rather than treat that patient based on what's now largely guesswork in ways by clinicians, we'll be able to look at all the patients that came before the one we're treating, and out of those hundreds of millions ultimately of patients, say here are the ones that look like this patient at a molecular level, and we know with statistical certainty what treatments they best responded to, and we can use that kind of data-driven approach to prescribe the best treatments for that patient. And as we do that many times, these kinds of studies are going on across the world, we'll be able to harvest that information on hundreds of millions of patients and understand the mechanisms of disease with an unprecedented level of detail, and develop the next generation of treatments based on that understanding. And what you guys all do in imaging is always been at the forefront of big data in biomedical research, certainly from a data volume standpoint, and also it's the application that's been the best application of AI and some of the most advanced machine learning technologies that have come around, as we'll hear about in the next talks. So I'll talk a little bit about how we want to do this at a high level. One thing that I think about a lot is that in order to work in this kind of big data collaborative way, we need to focus on the cultural aspects up front of how we work together. And what I've been starting with is just the values with which we want to work within these very large joint cross-institutional projects that we'll be launching. So I codify this in a few ideas that I'll go through briefly. The first one always is to realize above all that what we're doing is for the patient, and that should kind of supersede everything else, what's good for the patient. The second is simplify. So if we look at the last decade or so in the field, it's some of the results can be a little bit scary in terms of how much reported literature is not reproducible, and to me a lot of that is because these studies are too convoluted in a way in their thought process, and they don't adhere to what real masters in their fields know, which is to kind of boil things down to their most simple, kind of straightforward elements. So, I like to think about if there's a, image, this is a few from our department that just very clearly show, the results that we're going for. And what you guys are doing is, maybe the best example of this, when you can show a beautiful image and know exactly what you're trying to show at a mechanistic level. And last night I was amazed. I can't believe how much talent you guys have in this department, in this institute, artistically and otherwise. Some of those images were just amazing. I was thinking we should have maybe an art of the genome exhibit, but I don't think it would necessarily be as nice as yours. As we're working together, sharing data openly, sharing data ideas openly so that we can all kind of build on each other's work. And what you guys are doing with the image data warehouse could be one of the most important examples of this. If we can really take data on 1 million patients per year and use that to inform future therapies, inform our discoveries, that's an amazing contribution that we can make as an institution to our collective work. In order to kind of work together, we need to define areas that are fairly focused. We want to have people working across many different things, but in our strategic areas, we need to define a few big directions that we really want to make an impact and lead the field and allow people to work together within that construct. In our department, I use the example of the network modeling approaches that have been led by Eric Schott and Bin Zhang and have been used to impact studies across many different diseases: cardiovascular disease, Alzheimer's, cancer, and we want to really build world strength in certain areas of big data analysis and other areas that we really want to make an impact. If we do focus on those kind of big strategic projects, that the ultimate goal is to achieve synergies between our efforts. I highlight a slide put together by our psychiatric genetics team where they're all have kind of complementary expertise that all fit together within a kind of big initiative that they want to lead in terms of mining the biggest psychiatric data sets in the world, coming up with novel predictions, quickly validating them and translating them. So, this kind of thing, the more we can do that, the more we can kind of have people with complementary expertise who work together on a common goal is exactly what we want to do. And do this in an agile way where, the best contributions are rewarded, and avoid, be a penguin with a rocket ship on their back and not a fat cat with a cigar is the image for this. And finally, at the end of the day, we are very delivery-oriented. This big new investment in precision medicine is based on the great success that has happened here in the past 10 years or so. So, at the end of the day, this is what matters. So that's first. This is kind of how we want to orient our new projects. And then mechanistically, this is the kind of areas that we'll be investing in, at least on the genomic side, and these should link in closely with what we're doing in other fields so we can achieve those synergies, focus areas, and work together. I'll go through them briefly, just so people know kind of where we're headed in the next few years. We're certainly doing a lot of faculty recruitments, up to 30 in the next 10 years. Designed to build out strengths in the key areas: big data analytics, functional genomics is one that I put in our plan, and you guys are certainly doing your own recruitments, and we should figure out how those people can work together. We're also investing in a little bit more, creative mechanisms designed to spur this kind of teamwork and big picture goals. One of them is to put resources not just in individual recruitments, but in projects, and then align people based on what's best for the project goals. We're planning to do one kind of big one per year. The first year, the charge is to build out a pretty big initiative in cancer. In the next couple years, we'll decide. I think immunologic diseases, brain and cardiovascular are probably the leading contenders, but we'll be thinking about that. And the projects, I use this example that the PsychGen team put together, but this is really the kind of thing we want to do. How can we be world leaders in leveraging large data sets in a given field to rapidly make predictions, test them, translate them to therapies? And most of, at least from my side, what we'll be investing in is the computational modeling and functional validation that are kind of directly downstream of the big data sets. So at a very high level, the cancer project will follow that paradigm. It'll look something like this, where we have a patient who comes into Sinai. We measure all sorts of things about their disease, interpret that in the context of all available public data that's relevant to make insights on new potential therapies and drivers. Use the network methods that we've built strength in over the past decade or so, and simultaneously predict new therapies, combination therapies on that patient that we can rapidly test in patient-derived functional models, and based on the intersection of the two, either preclinically validate those new targets or translate them actually directly to patients through molecular tumor boards. And we actually want to demonstrate within a year, I think, that we can help patients, core value number one, actually demonstrate that we're helping patients by implementing this kind of thing. And certainly the radiological imaging should be a component of this, and we should discuss how and if it might fit in with this kind of a big initiative. In addition to faculty, we'll be hiring professional data scientists who largely will work on these strategic projects, but are people who are really amazing at working with big data sets and can contribute to our actual analysis. And graduate training is a big area that we're substantially building out. We're starting to work on really a marketing PR campaign that's designed to attract as many great graduate students as we can get, and that's going to be going on so that next year we build our stable of graduate students even bigger, so they can work on these exciting projects. And finally, we'll hear from Facebook in the next talk. I've thought a lot about what these big data companies have done that allow them in many ways to innovate faster than we do sometimes in academia. And one thing that has been emphasized, you can correct me if Facebook does this or not, but is to create really robust platforms that allow people to make much more quicker, bigger impact of their work, kind of amplify their work, and allow them to focus on the real high value add activities without having to reinvent everything across the whole stack of a research project. So that's another area we'll be investing in. From the data side, we have Minerva is a perfect example of a platform, and we want to do more of that in terms of creating big data sets that we can access. Imaging Data Warehouse is a perfect example of a platform, so it's great to hear you're doing that. And certain genomic profiling, functional validation platforms is what we'll be thinking about. And we will be, letting the world know that we're launching the biggest, best, most exciting, most innovative big data kind of precision medicine initiative that's going on. And this is something that we will make an effort to make known pretty widely. So that's at a high level where what we're thinking in terms of the next few years, what I was brought in to think about. As you see, I kept this at a pretty high level. That's intentional because all of the details shouldn't be up to me. It should be based on many discussions. That's been the priority that I've done over the last few weeks, is just to meet with as many people as I can. It's been really inspiring, and this is a great community to also meet with and learn what you guys are thinking. And I'm really happy to be able to participate, learn about the great research going on in your world, and after this, think about what we might do together to bridge between the imaging and genomics world for in the context of joint precision medicine projects. Thank you.